Hi, this is Dr. Tolulope Alugo from St. John Cap. Today we're going to be continuing our series on anxiety disorders. Remember the last time I spoke about anxiety disorders, what they are. I spoke about the fight or flight response, told you the story about the caveman and how, he may become revved up to either get into a fight or to run away from another caveman. We spoke about social anxiety disorder. So today we're just going to continue. Another type of anxiety disorder is generalized anxiety disorder. This is one in which a child may worry about every aspect of life. Worry about their future, worry about your safety, worry about school, can't sleep, the what ifs, what ifs, what ifs. You may also have separation anxiety disorder where they're afraid to be away from home. This may be triggered by ill health in a parent, for example, or a life event. And so they want to be home all the time. They're calling or they're refusing to go to school. You may have a specific phobia where they're afraid of one particular thing, a fear of spiders, fear of clowns, and this is extreme fear that really gets in the way of everyday life. Those are some of the common anxiety disorders. How are they treated? The first line treatment for anxiety disorder is talking therapy or psychotherapy. And psychotherapy aims to do a couple of things. One is education, which is what we're providing here. So information as to why we feel anxious. Then psychotherapy would look at strategies to reduce that fight or flight response. This may include teaching your child relaxation exercises like deep breathing, muscle relaxation, visualization, like kind of imagine themselves in a calmer space. It may look at challenging the negative thoughts that make them anxious, such as mom isn't going to come back if she leaves me at school, and helping them to reframe that kind of thinking. It may help with reducing avoidance. So for example, we said most people will avoid what makes them anxious. So a teenager who feels anxious when they have to answer a question in class may decide to avoid asking questions or answering questions, may decide to actually start missing school when they have a test coming up or a presentation, may avoid going to be the one to order something when they go to McDonald's, for example. So psychotherapy would look at targeting those avoidant behaviors and helping your child expose themselves to anxiety-provoking situations without avoiding them, whilst using their relaxation exercises. And this can be, quite effective. If talking therapy on its own, the exposure to anxiety-provoking situations, relaxation exercises, and so on are still not enough, where your child is now missing school, not able to go for family gatherings, where the anxiety is just really impairing them, then medication becomes another option that can be added to talking therapy. A lot of research shows that combining both gives you better outcomes than either of them on its own when you have moderate to severe symptoms. So don't despair if you or your child are experiencing anxiety. There's a lot of support available. Reach out to your healthcare provider, educate yourself on, strategies that would help. Be part of the solution. So, for example, if your therapist or their therapist is saying, we need your child to expose themselves to anxiety-provoking situation, even though it's unpleasant, you have to encourage your child to do so and not give them a free pass to avoid going to school or avoid being the one to step forward to maybe ask for something in a store. Every time you give your child an opportunity to expose themselves to an anxiety-provoking situation, their anxiety actually gets better. So it's always a win for you. All the best, and watch out for upcoming videos where we discuss more mental health disorders in children and how to make things better for ourselves and for our kids.